with the patient story. This is Dr. Sam Siegel, and she's going to take us through cancer survivorship. We're going to talk about sex. We're going to talk about mood. We're going to talk about a bunch of things related to cancer survivorship. Sam, do you want to go ahead and introduce yourself, tell a little bit about your story, and then we'll go from there.
Absolutely. I'm so just honored to be here today discussing these topics that just these quality of life topics that really mean a lot to me. This is actually how I found the Patient Story website initially, because when I first got diagnosed and then when I was going through my relapse, I was Googling late in the night, doctors with Hodgkin's or, moms with cancer. I knew where to find all the doctory information, with PubMed and all my resources as a physician. But I wanted human answers. Like, am I going to be able to have intimacy with my husband? How am I going to be able to connect with my kids? Will I have enough energy to fold the laundry and cook dinner? I needed human answers to my cancer questions. And so I found the Patient Story as a resource for myself to sort of get through that. And then I reached out to you guys, and it's kind of evolved into this beautiful partnership where I just feel so privileged to connect with all my cancer crushers out there in the cancer community. And I just feel really connected with all of you and all of your stories that I've read in the comment section. And it just, means a lot to me to be here today. I'm a 2-time cancer survivor, relapsed refractory Hodgkin's, had a bone marrow transplant, and I'm just finishing up post-transplant consolidation therapy, which is basically like the after therapy where you're in remission, but my relapse was so soon after my initial diagnosis that they wanted to give me extra therapy after my transplant just to make sure that we really get it all and that I stay in remission. So that's where I'm at. Yeah.
Thank you for sharing that with us. That's awesome.
Yeah.
Well, let's just dive right in. So how do you define survivorship? How does it help patients and care partners?
Absolutely. In its most basic concept or definition, cancer survivorship is sort of a cancer survivorship plan is sort of a document that you can put together with your oncologist or a primary care doctor or somebody who practices survivorship medicine, which could be an oncologist or an internist or a family medicine doctor. And at the very least, it should address, it's kind of a document that you keep with you, and it should address the therapies that you've had and the types of screenings going forward or ongoing care that you should have after having the type of cancer that you've had and the treatment that you've had. So an example would be, in Hodgkin's, it would be, did you have Hodgkin's in your 20s? Did you have chemotherapy that had some toxicity for your heart, and therefore you need to kind of watch your heart more closely going forward and really address your risks for heart disease? Did you have chest wall radiation in your late teens or 20s, in which case the timing when you would start having mammograms would be different than the average population? So it's kind of a concept of the care that you need based on what's happened to your body, going forward. What I'm pushing for is a more broad definition of cancer survivorship. I think that basically cancer survivorship is anybody who's continuing to live after a cancer diagnosis. And that surely can include people who are cured or in remission. But there's so many people now, especially with the amazing therapies that we've had, that maybe will be diagnosed as metastatic when they first start off or late stage, but they're going to live a long time. They might live 20, 30 years with the different therapies that we've had. And so how that time is experienced, how somebody's able to live in their life, connect with others, be fully alive, that's what I think cancer survivorship is. And that's everything else. That's recovering from the trauma of treatment, both emotionally, mentally, physically. It's having a set of tools that helps your body kind of move out of the intensity of the treatment experience and regain a state of wellness, because getting cured and feeling healthy are not one and the same. It's quite possible that somebody could be cured from the therapy that they have but, feel really awful at the end of treatment. Or have ongoing, if they're having ongoing therapy, they have a lot of adverse effects relating to the therapy that they're having. And even though they might be getting time, it's not necessarily quality of time because they're having so many symptoms from the therapy. So how somebody feels in their physical body after a cancer diagnosis should all be part of the concept of cancer survivorship. And one of my best friends, Tati W., whose story with her walk through leukemia this week went viral. I mean, she's already had so many views. And she's one of my best friends and somebody that I met in my blood cancer support group. And she said something to me like, Sam, I just want to be fully alive until I'm not. And I love that. And to me, that's what cancer survivorship is, regardless of your, are you on curative intent therapy? Are you cured? Are you in remission? Are you continuing to walk through your life with an active cancer diagnosis? Like, let's reclaim our lives and be fully alive until we're not. Because I think one of the hardest parts for me was that cancer didn't just impact my fears about death and dying and my life being cut short. Initially, before I sort of felt a transformation, I feel like it took so many other things from me, like my sense of beauty and confidence, my at some points it took away from my cognition, which was really scary as a doctor. I couldn't think properly. And so it can give people a lot of wonderful things, after a cancer diagnosis, in the way that it helps you think about your life and how much every moment means. It can be so beautiful. It can also take a lot of things away from people, especially until they've worked through some of that. And so in my mind, a comprehensive cancer survivorship program would address all those things, not just what chemo have you had and what are you at risk for in the future, but it gives a space and a voice to, what did you go through as a human, existential fears of death and dying? How do you conceptualize yourself and your physical body, in your marriage and relationships with your children, in your community, all those things. So that's what I think cancer survivorship is. It's kind of, and it's an evolving area of medicine right now. It's so, but it's good. I want that word out there because I want people to ask, not every cancer center has a cancer survivorship program. So ask around and there's like organizations, there's something called National Coalition of Cancer Survivorship. They're amazing. Cancer.net has some awesome stuff. ASCO is also an organization that has some cancer survivorship tools. So just know that word and start asking about it because it might open up some doors in terms of improving your quality of life.
Yeah. Wow, that's incredible. Thank you for sharing that.
Totally.
I mean, on that, how does cancer treatments affect sexuality, intimacy, sex life, just your day-to-day, whether you have a partner or not? How does it affect everything? How do you deal with that as someone that's going through it?
Yeah, that's a huge question. I feel like we could talk about that just for like a whole hour, just that topic.
Let's go for it.
But man, sex and sexuality, in my own marriage, we have been through lymphoma, which for me was a 40-pound weight gain and baldness and bloating and pain. We've also, with my husband's stuff, we've been through testicular cancer, liver transplant, inflammatory bowel disease with ileostomy, so just a lot of things. And we've had to reinvent our relationship with one another and how we think about ourselves and our intimacy together so many different times. And so I would start off by saying it's really important to have a good sense of humor, like whoever you're being intimate with, because it's going to require some troubleshooting, physically, mechanically, emotionally, it's going to require some troubleshooting. And if you can have somebody that you feel really safe with, that you can, that you can talk about your feelings of vulnerability and just get rid of like the guilt, fear, and shame in the bedroom, it will just help so much to sort of get through. Because some of the issues are really embarrassing, for people who may have had pelvic radiation. They can have sort of like a scarring in the vaginal area. And so the vagina can become tight. And so just penetration is extremely painful. But there's things that can be done about it. There's vaginal dilators, there are vaginal moisturizers, lubricants, even vaginal estrogen creams. And so there's things to ask for, for your physician. And I would say, like, don't trust that your doctor is definitely going to come out and say, like, how's vagina doing? The oncologists are really busy. There's not enough oncologists for all the people that have cancer. And so, especially once you're out of the danger zone and you're maybe in a little bit more of a stable path, really important quality of life issues that might come up for you might get glossed over by a very well-meaning cancer physician because they're more worried about just helping you stay alive and your mortality and major complications that smaller things may not be proactively asked of you. So you have to bring it up. You have to feel empowered enough to bring it up with either your cancer doctor or your primary or your gyno. But it's, depending on what type of cancer you've had and where it affects your body, it can be a head trip from the very beginning. I remember the day that my husband got his testicular cancer diagnosis, all in the same day. We saw the urologist on Friday, who said he was going to operate on Monday and do an orchiectomy to remove the affected testicle. And then he said, oh, yeah, you guys haven't had kids yet, you're married. Yeah, it's about 3 p.m. I think the sperm bank closes at like 4:30. You guys gotta, get down there. So we're like riding in the taxi cab, holding each other and crying and, trying to just logistically get to the sperm bank before it closes in Philly on a Friday because he's having surgery on Monday. And then the poor guy's gotta like perform. He's just found out that he has cancer and he's like, oh my God, like, we're in medical school, how are we gonna get through this? And he's got to like perform and produce a sample because maybe our future family depends on it, So that was great. Goodness. That was crazy. And I think that, I'll never forget that day and how it impacted our marriage and his, his concept of his own manhood and sexuality. And I know that a lot of women go through the same thing in sort of a different way. And so, but the fertility discussion can also be on the flip side. Like for instance, there's a lot of people who don't want to have children and they can feel like the focus of the conversation with the physicians is fertility preservation. And they have said over and over again, like, hey, not everybody wants to have kids. I don't want to have kids. And it's like, are you sure? Are you sure? Are you sure? And I think some people, what I've heard in my conversations with other survivors, is that it was sort of, that was upsetting to sort of have that fertility and reproductive conversation be brought up over and over again when they've made it very clear they're a human who doesn't want to have children. And that's like a totally valid and important choice too. Not everybody's sexuality relates to their ability to reproduce or, so I think letting the patient define that and sort of vocalize what they want instead of putting it on them is really important. And so, yeah, there's some people might be trying to have sex again after they have an ostomy and just, figuring out, like, do you wear a stealth belt to help with your urostomy or your colostomy or your ileostomy? Maybe trying new positions can help with that. Thinking about for people who are going through testicular cancer, do you want to have the prosthetic testicle put in? Is it really important to you to have it look like you have 2 testicles? Maybe not. Everybody has a different kind of experience with that. Just like some women don't want to have breast reconstruction when they have breast cancer. They feel that's not the right option for them. And so I think just feeling confident to reconceptualize how you feel about your body and your sexuality and not letting anybody else define it is really important through the cancer experience. Yeah,
that makes sense.
Yeah.
Thank you. Gosh, that was really interesting. Sorry, I'm making you move again, but do you
Oh,
mind moving?
In fact, I
Almost
brought
there.
I brought some paintings just in terms of like
Oh
beauty
yeah.
and feeling sexy. This is a
Oh yeah.
painting that I did when I was on the bone marrow transplant unit.
Oh my
Can you see it?
goodness.
And
That's incredible.
that's how I felt about myself and my body. I just felt
Oh wow.
like this darkness, this this blackness, this
Yeah.
felt like ashes. I mean, the transplant was really tough, and the medications were tough, and that's kind of how I conceptualized myself. And this is another one that I just painted just recently, and this
Oh
is
my goodness.
a little bit more about how I'm conceptualizing my my body and my sexuality and things like that at this point. So
That is gorgeous.
come a long,
Incredible. I
it's
didn't know
come
you
a long
painted.
way. It's come a
How
long
are you?
way.
That's incredible. You
Yeah.
paint, you're a doctor, you're a mom, you're going through a wife, you're going through all this stuff. Oh my goodness.
Well, art has been really helpful for me.
Really?
Yeah, I haven't necessarily thought about myself as an artist for like a prolonged period of time, but a
Right.
friend told me that doing art, like just holding the paintbrushes, or playing my guitar, working with clay for sculpting, were all
Mm.
ways that I could help my brain and my nervous system rehabilitate from all the chemo that I've
Oh,
had
interesting.
and the peripheral neuropathy. And so art has been a way that I'm just trying to rewire my brain. Yeah. And I think it helps emotionally as well to sort of get some of those feelings out there in
Yeah. Do you think it helps you work
nonverbal
on?
ways. Yeah.
Right. Right. I know. Yeah. And I mean, so many people talk about chemo brain. Like, how did that help kind of unlock something in emotionally or just mentally if you're doing something, yeah, physical or artistic?
Yeah, absolutely. Um,
Interesting.
yeah,
Wow.
yeah.
Those are gorgeous.
Thank you.
Yeah, amazing. I mean, do you have anything else to add about that? I don't want to cut you off. This is such great information and really helpful. Like anything else with, like you mentioned, people that are maybe single, like what do they consider? I mean, how do you feel like yourself when you're going through treatment and feel comfortable with your sexuality in a way um, that helps you feel independent at the same time too? And yeah, like yourself, like what are some just practical ways? That, I
Yeah,
mean, I know everybody's different, but how do you tap into that and find what's right for you?
yeah. No, that's really interesting. Body acceptance kind of maneuvers have been an important part of my recovery and evolution from cancer diagnosis to now, where I'm feeling a little bit more like myself. And what I mean by
Mm.
that is that I've spent a lot of time looking in the mirror at myself naked. Look, and especially when right after my treatment, when I, was 40 pounds heavier, I was
Wow.
covered in rashes all over my body from all the treatment that I've had. No hair, no makeup, scars, new scars. And I just sort of
Wow.
forced myself to look at my body and say, okay, this is your body now. And I would like hug myself. I'd wrap my arms around myself and I'd hug myself and just say, this is the one body you've got. Like, just love it and be good to you. And just sort of talk to myself that way. It maybe sounds a little nuts, but it helps me a lot.
Mm-mm.
And I would try to send love to the parts of my body that had experienced surgery or catheters. Like I would go, I'd kiss my fingers and I'd put it over my port site, or I'd kiss
Mm.
my fingers and I'd put it over, where I had my chest tube when I had my cardiothoracic surgery. And
Wow.
sometimes I want my husband to do that too. I want him just to like send loving energy to the parts of my body that have gone through, the various medical traumas. And that's been helpful, and just vocalizing that to him. Also, I do things like I try to dance every day. Like just my pump up music could be something like Dua Lipa or whatever, some dance club music, and just tapping into that body movement, that dancing. It doesn't have to be for anybody or performing, but just getting comfortable in your own body and a body in motion, and reconnecting with yourself and your sexuality that's been helpful for me.
Wow.
Yeah, so I do things like that, and that's helpful. What else? Those have been some major,
Wow.
yeah.
How did you know to do that? I mean, how did you learn? Was it like a learning experience? Did someone share that with you? I mean, what,
Yeah.
or is it just your understanding of like psychology? How did you know to do those things to help yourself?
Well, I think that first of all, it was a journey. I did not start off body positive like that.
Mm,
I felt gross. I felt ashamed of the way that I looked. Um, I did not feel good about myself. And at some point, I just got tired of feeling that way. I think I just said, I don't, yeah, cancer broke me open and it was my undoing, but like now it's going to be my rebirth. And I want to reclaim my sense of self and beauty and sexuality. Like I'm just tired of this disease taking stuff from me.
right.
This cancer experience taking stuff from me. Like maybe I can be a badass baddie and sexy and awesome, even going through cancer treatment. And so I just
Right.
started reconceptualizing that and then talking to friends who are going through cancer and just about,
Hmm.
what are you doing? How do you feel? Are you still having sex? Like, and that's been really helpful. And just connecting with other people, other cancer
Hmm.
patients who are like, yeah, still having sex. And and I think that's really important. And then there's also just this is separate from what you're asking, but there's some logistical issues with having sex throughout cancer and cancer treatment. Like, is your
Oh,
platelet count
right.
low and do you have to be careful? Are you neutropenic because of your chemo or you have a blood cancer? And therefore like penetrative intercourse or anal intercourse is not safe. Um,
Mm.
so there's certain, logistical things with where you're at in your cancer, where you really need to ask your doctor, like, is it safe for you to be having the types of sex that you want to have? So that's
Right.
important. I forgot to mention that. But another way that I found my way back to like body positivity is actually watching my husband do it. Um,
Oh,
there have been times where he's getting out of the shower and you and I were just remarking that my bathroom here just doesn't have a door, which is unlike any other place that we've lived, but the bedroom and bathroom are not separated by a door. So we sort of see, somebody's in there brushing their teeth or looking in the mirror, and we're in the bedroom, we can see one another. And I've seen him like flexing in the mirror, with all these various scars, and he's not doing it for me. I think he's doing it for himself, like just getting used to his body and what
oh,
this new
wow.
body looks like with these huge scars and just finding a way to like feel confident looking in the mirror. And I used to tease him about it. I thought it was really entertaining, but now I'm like, maybe there's something to it, what he's doing.
Yeah.
And so then I was like, all right, I'm gonna take a page out of Sam's book. His name is also Sam. So take
Oh,
a
I
page
didn't know
out.
that.
Yeah.
Sam.
Sam and
Dr.
Sam.
Sam's.
Sam squared. Very confusing in medical school, but
I'm sure.
yeah, yeah, yeah.
Um, oh yeah, now you're in frame. Can you move a little more? This
Yeah.
is that where you guys met at medical school?
No, we were together before med school,
Oh
which is
wow.
pretty amazing because there's no couples matching process for medical school. They have it for residency, but we just
Hmm.
sort of get in where you get in. And so
Yeah.
we were married before medical school. We met in San Francisco. Um, yeah, and I was finishing up my undergrad. He was doing his post-bac pre-med stuff because he majored in something completely non-medical in undergrad.
Oh,
He was
interesting.
political science and African American studies, and then decided to go into medicine. So that's where we met. And yeah, we went to school together. And the first year of medical school, and was also the first year of our marriage. And it was like, okay, we're either going to kill each other or we're going to be best friends and be super close, and our marriage is going to be really amazing. And fortunately, it's been the latter. And we've been together
Oh,
18 years, and we've kind of reinvented ourselves a million times together. But I could not walk
wow.
this walk without him. He is amazing. Yeah.
Wow. I
Yeah.
mean, what advice do you have for care partners? And I mean, even if you're the person going through treatment, like what advice do you have for keeping that relationship strong, whether that's like the sexuality side, relationship side, emotional side? Like, I mean, you have 18 years. Oh my goodness. Like,
Yeah.
what insight can you share?
Well, when I knew that he had some medical challenges that he was facing even before we got married. And
Mm,
so I really asked myself, like, are you in this? Because don't mess around with this if you're not in it. It's not fair. He's really put himself out there honestly. And so I just sort of thought, yeah, sure, I could break up with him and be with somebody who's perfectly healthy. And
mm,
then, something unexpected could happen. You could get hit by a bus. I mean, none of us are promised tomorrow.
mm,
But also, there's no saying, somebody could develop illness out of the blue. And I just sort of had this intuition that my life with him, even if it was going to be messy and complicated because of all of the health issues, that I would learn more about the human experience, about love, about perseverance and determination, like walking our life together, than if I was to sort of break up with him and try and find somebody who was like perfectly healthy.
mm.
Because he just already seemed to know himself so well. And he had this confidence at 25, this sort of energy that he knew who he was and that he would walk my life with me, but not try to control who I am. Like he would just accept me and be there by my side. And so I just always had this intuition with him that, yeah, maybe it wasn't perfect and it wasn't ideal. And there were going to be all these things that we were going to go through together that would be really hard, but that our life together would be, so worth it. And I feel that's definitely true.
Right.
So I guess what I would say is that if you're out there and you're dating, I know it's a very different world now than when he and I were dating. It's all the apps and the swiping and the profiles and
Right.
don't be afraid that you have to be perfect or that having gone through a health condition like cancer or any other sort of chronic illness is an
Mm,
automatic uh, checkbox against you, that it's
right.
something that's going to work against you. Like you, you still have so many things to offer, and finding love is possible, and somebody to sort of walk your life with you. So I would say don't feel like it's something to be ashamed of or that you can't put out there. Like if you're getting people who are put off by the fact that you have dealt with illness, like maybe that's not the kind of people that you want in your life anyway. Um,
Right.
but you also need to disclose it when you feel ready to disclose
Mm,
it. Because I guess that's the other thing is, it's important
mhm.
to be honest and have honesty in a relationship, especially a new relationship. But, you don't automatically, I think, have to say your entire life story up front. Like you can kind of gauge
Mm,
whether or not you're going to be well matched with somebody and whether or not you emotionally trust them, and then decide if it makes sense to share your health experiences and all that. So, yeah.
wow. How do you gauge that? Like, at what point do you have that conversation? If you are just dating, if you are on Tinder or whatever and meeting a bunch of different people.
Gosh. Yeah, I have any perfect answers for that question? I don't know.
Does
I think
anybody?
it's I think it's all just like personal comfort. Some
Right.
people are not going to feel comfortable putting their stuff out there in terms of their health conditions, and that is a valid position. Um,
Hmm.
some people want to know upfront that the person that they're seeing or even thinking about potentially dating is going to be somebody who's going to be okay with chronic health conditions or a history of
Mm,
cancer or ongoing cancer. Um, so I think it's important to really get quiet with yourself and think about what you want. Like, is it something that, like, is it a deal breaker up front if somebody seems like really nervous about it? Then
mm.
maybe it is the right thing to disclose it really early and upfront, um, and then go from there. But I think thinking about what you want and then how to move forward is probably the way to go.
Yeah.
Yeah.
Interesting.
I guess
Wow.
like the other thing is like, I just don't think you have to have it all figured out. And that's
Right.
one thing, like if I could go back and tell my younger self some advice, I think
Huh.
I felt like we had to have it all figured out. Like, how is this all going to work? You know, how are we going to like get married and have kids and both be doctors? And I don't think I could have ever foreseen all the crazy things that we would go through as a couple and as a family.
Right.
But you know, now I know we didn't need to. We didn't need to have it figured out. We just needed to like return to that love, that commitment to our relationship, that devotion to one another, and that we would find our way through. And sometimes like it turns out more beautiful than you could have ever imagined, and you certainly never wish for all these horrible things to happen. Like, would it be great if we didn't have to go through transplant? Sure. You know,
Right.
that would be awesome. I would have loved to become this spiritually elevated without having to like go through 2 years of cancer and cancer
Right.
treatment. Like that would have been great. But it's all, my life now is also like more beautiful than I could have ever imagined. And the people that are in my orbit now, my friendships, my professional relationships, it's just like something that I didn't even expect. And so I would just
Interesting.
say like with cancer and fighting cancer, or coping with it, whatever terminology you use, not everybody likes that sort of war fighting analogy, but with the cancer experience, I think it's really important to move ourselves out of a place of fear. You know, and that's way easier said than done. But I think moving out of fear-based decisions, fear-based language is really important to give ourselves the best chance of you know, doing well with the illness, and then also enjoying the time in our lives that we have.
Right.
Yeah.
How do you move out of that fear? I mean, what can help with that?
So for me, it's been using a lot of different modalities. I'm interested in the field of integrative medicine,
Right.
and integrative medicine kind of gives a language and a practice model to the mind, body, spirit connection. It gives like a voice and terminology to sort of talk about that, and how what we think and feel impacts our experience in our physical bodies, and vice versa. How what you feel in your physical body impacts how you think and what you feel. And it sort of utilizes all these different modalities as part of the treatment, like acupuncture, massage, body energy work, supplements, could be chanting, could be music therapy, art therapy, exercise, eating a really clean diet. I think eventually integrative medicine will just be medicine. Like hopefully as a medical community, we'll become woke enough eventually that that all these modalities will just be part of the medicine, in addition to the chemo and the radiation and surgery and all the stuff that you're having. Like enough validity will be gained and recognized that we'll know that, okay, here's the chemo pills that you need to take, or the targeted therapy, and also your acupuncture appointment's going to be on Tuesday, and your massage, you know, all those things. That's my vision. My vision.
Yeah. Yeah. Why do you think so many doctors or oncologists are like hesitant to recommend those things?
I think there's just a lot of this, like, well, that's not real. Like the real medicine is the one where you're, you know, it's the chemo and the radiation, the surgery. But I think that I know personally for me, now that I'm really in touch with that mind, body, spirit connection, that's sort of ebbed and flowed all throughout my life. I can feel my fight or flight going off. Like I can feel when something really upsets me, and then like heart starts pounding, and I'm like, I have a stomach ache, and I feel like I got to empty my bowels, and I get a dry mouth. Like I'm in a physiologic state where I could run away from a lion on the savannah, But maybe while I'm just sitting here in my bedroom and I'm not actually in any kind of danger at all, maybe that's not a good physiologic state to sort of heal my body through cancer. And so it is a very real thing. And because it's not able to be as easily measured and experimented on and isolated in terms of variables, especially in this era where there's a lot of focus on evidence-based medicine, which is really important. But there's sort of this feeling like, well, if I can't define it and I can't prove it and I don't know exactly how to measure it, then it's not real. And I don't believe that's true at all. I think there are experiences that people go through in their lives that maybe we don't have a way to sort of label them or measure them perfectly yet in the scientific community, but that doesn't mean that they're not real. So like one example for that would be like during my transplant, I felt I had this couple days where I felt I was on a rope or a string. I called it the in-between, where I was so loosely connected to my body that all I had to do was sort of let go and it would be over. Like it just felt really precarious like that.
Wow.
And since I started, like, it took a while to even be able to put that into words or talk about it. But then once I did, and I started talking about it in my blood cancer support groups and talking to other transplant patients, person after person was like, oh yeah, that thing. I remember that. I was there too, you know?
Oh, wow.
And so it was something in this metaphysical space that was a very real experience for like a lot of different people who come from a lot of different religious, spiritual backgrounds and stuff. So
interesting.
do we know exactly, can we exactly define what's happening there in that space? No, not yet as a, a science and medical community, but it's very real and it's very similar for a lot of people that go through that experience. And so I just think that that as physicians, we need to recognize all of it. Like, unless it's harmful to a person where it's going to interact with your chemo and cause like organ dysfunction or something really dangerous, why not do every single thing you can do to feel better? And maybe that's doing conventional therapy and integrative medicine at the same time, or doing your conventional therapy first and then doing integrative therapies to heal your body through like the toxicities of treatment that you experienced. So there's so many important ways to use integrative medicine to get well.
Yeah. What was most effective for you, or what really stood out or surprised you that really helped? You talk about the toxicity after treatment. Like, how did you help clear that out?
Yeah.
Oh yeah. I moved this way a little bit.
Okay. One thing recently, is it good? Are you good now?
Little more.
That far, really? Okay.
Yeah, it's just Instagram.
Okay. So one thing that recently for me has come up, and this goes back to the sex, the sexuality, the body positivity, bodily comfort. I realized that I need to incorporate regular practices of positive body touch. And what I mean by that is that my body feels traumatized. Like, I have body memory from all the poking and prodding, the catheters that have been in my chest that got yanked out, the feeling of the transplant conditioning chemo, the surgeries that I've had, the biopsies. Like, I have every week when I get my blood labs taken and I can't find a vein because they're all scarred now, or when I have to have 4 different people try to get my IV when I'm getting my therapy. Like, just so many things happen to our physical bodies that we endure and we get through it. But I know for me, I just started feeling like just sort of clamped down, like on edge all the time. Like, nobody touches me in a nice way. I mean, my husband, he's tired. We have 3 little kids. The kids are like jumping all over us and the dog's running around the house. And I forgot what it felt like to be touched in a way that's like healing and loving. And I need that. And so I started incorporating massage into my regimen to really get me through the end of my my treatment here. And that's been really helpful.
Hmm.
Like I remember a session recently where I went to the massage therapist and I had had a really rough day. Somebody that I had been interacting with as doctor patient, had passed away. And I was just so sad. And my body was really in a state of just feeling upset and fear. And I could feel it. And she could feel it when I walked in. And she said, "Wow, yeah, you seem upset today." And by the end of the session, my nervous system had calmed down. Like I walked out of there in a very different state of being than when I walked in there. Like just being touched in that loving way, where she didn't want anything from me. She was just sending me loving, healing energy, touching my muscles, my arms, my legs, my back, in a way that felt good. Just calmed down my nervous system, and I could feel myself relaxing, getting out of that fight or flight mode. And then like the rest of my day was better. The rest of my week was better. I was a better person for everybody else in my life. The next time I got my therapy infusion, I felt emotionally ready to get it. So that's been really helpful. So like just feeling body positivity, but integrative medicine also helped me to heal from the toxicity of my therapy. So I had so much chemo and so much steroids during my transplant because I was really nauseated. And so I developed glucose issues. Like I was really close to diabetes, and from all the weight that I had gained and the steroids. And I just sort of finished all that thinking like, well, I guess you got to pay the piper. I'll be able to stay alive, but I had to pay a price here. And, in order to stay alive, this is the price that I paid. I might just be diabetic now. And I'm just not going to be as healthy as I was before. And that's sort of what I feared. I thought that health and vitality and wellness were off the table for me because of all the therapy that I had. And that was tough. That was a tough place to be in because I started this whole journey as a vegetarian marathon running doctor mom, like, just boom, 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 healthy,
Right.
And so I just thought, okay, it's just going to be a very different physical body now and experience in life. And then after a while, I moved out of that and I thought, let me just try some things. And so it was after getting really, really low, like physically all the stuff that I was going through, but also, I had a tough time, like cognitively and emotionally after my transplant, coming off the medications from the hospital, the palliative medications that I needed. I needed really strong pain medicine, like oxycodone. I was on, in addition to Tylenol and the other meds and the steroids. I needed, in addition to all the Zofran and Amend and Reglan and all the other nausea meds, I was also on 4 milligrams of Ativan a day. 1 milligram of Ativan every 6 hours for nausea, vomiting. And so I left the hospital on that much opioids and benzos. And anybody who takes, a decent dosage, and it could be like the exact dosage the doctor prescribed you. You're not doing anything wrong. You're not abusing it. You're not taking too much, just exactly what the doctor prescribed you and what's written on the bottle. If you take that regularly for a month, 2 months, it changes your brain chemistry. And so coming off of it, even if you do everything right, you wean down exactly on the tapering plan that the doctors tell you to do, it's possible to experience like very severe emotional, psychological, neuropsychiatric side effects. For me, that was definitely the case. Within 2 days of finishing my tapering and my weaning, it felt like I would say that my brain was broken. My brain felt broken. I couldn't think. I had trouble just moving, doing things like brushing my teeth. I felt like severe depression. And it was so quick after getting off of these meds that I knew it had to do something with the chemicals, because I'm a upbeat person. I'm a happy person. And I had enough insight as a doctor, as a person who knows herself and who I really am, that this wasn't me, you know, these like random things that I would think like, maybe I shouldn't be here anymore. You know, I'm like, that's not computing. You just spent the last, year and a half fighting for your life. What do you mean you shouldn't be here anymore? That's not making sense. And so I knew that that I just needed to hang on and that I needed help. But I also knew that it was time to do something drastic to help heal my brain. And that's when I started reading a lot about chemo brain and the ways that chemotherapy, steroids, and the controlled substances that we need to get through the really harsh therapy that we have to go through. It's a process to sort of detoxify your body, to heal your brain. And there are ways that you can eat. There's fasting, there's juicing. And so I began to, and exercise. So like sweating for 20 minutes a day, where you're breathing hard. You're like a little bit, you're not quite at a conversational pace, like you're sort of out of breath, doing that for 20 minutes a day, and utilizing like the really clean diet, no processed food, no, minimal sugar, salt, oil, stuff like that, along with the sweating and the working out, and using those things as tools to help your brain. I think a lot of people don't necessarily make that connection. They think about like diet and exercise for vanity's sake, or just to like get your body back. But I did not feel motivated to sort of, from that standpoint. I was like, I don't really care what I look like. I'm so miserable. I was not even thinking about like getting back into my size whatever jeans. I was like, I am so despondent and upset and like such a shell of my former self that I need to start utilizing like extreme lifestyle tools to help myself feel better. And that's when I got into it. And then guess what? The positive benefit and the side effects of all the diet and exercise stuff that I was doing also happened to be that I reversed my prediabetes, got back in my genes, my liver inflammation went away, like all these, my mind cleared up. I started sleeping better. All these really magical and amazing things started happening when I got really serious about the diet and exercise and complementary therapies as a way to heal from the depression and the brain injury. Like I think about really strong chemotherapy regimens. It's like there's this term in medicine, TBI, or traumatic brain injury, like concussions that football players get and things like that. Chemo for some people, not for everybody. Some people can go through cancer treatment and they don't have these side effects, and like, right on. I'm envious of that. But these therapies can be like a chemical traumatic brain injury. It's like you had like a concussion from an injury, but you didn't. The injury was your chemo, and how it affected your brain. And I don't think we fully understand all the biochemical sort of mechanisms for how chemotherapy impacts your brain like that, but I know it does because I've experienced it. I had days when just going to the grocery store to get a list of 5 items was really hard for me. I felt like it was hard to go through my list and find items at the grocery store. I felt disoriented one day driving home in the little town where I live. Like I would have a very difficult time trying to prepare dinner and keeping an eye on what's on the stove and then what I'm chopping over here on the chopping board while one of my kids is talking to me and the dog is barking. Like that felt impossible for my brain. And so that's the degree, I think, of chemo brain or chemo related cognitive impairment is one of the terms where it's like a really more extreme version of that. And these lifestyle tools, like really working on your sleep, positive body touch, like massage, acupuncture, really clean diet, getting all the junk food out of there. Those are additional ways that you can help your brain heal. And so I just feel really passionately about spreading those messages because I think for me, that was one of my most hopeless times in my cancer experience, was when I saw how my brain and my thinking and my emotion, memory were impacted, and I was worried that it was permanent.
Wow. What was your
So,
experience like as a doctor? I mean, how did that impact working with patients or working with other people or learning new things? I mean, what was that like?
well, I didn't. I
Mm.
there were times when I just knew I should not be touching patient charts. Like
Oh, wow.
I would not want a doctor in my situation who's going through the types of cognitive issues that I'm going through. I would not want somebody like that taking care of me. And so
Wow.
I just sort of always would use that as a litmus test for, like, should I be working right now? And if the answer
Right.
is no, that I wouldn't want somebody in my situation taking care of me or my own, then I just, I let my work know, like, I'm not able to really perform to what I think is the degree that patients deserve. And so I really just try to, like, take the ego out of it. A lot of doctors, it's a big part of our identity. We're so spent such a long time in training, that when you take that away, it's like, oh God, who am I if I'm not a doctor? But I
Hmm.
also knew really deeply that I didn't want to hurt anybody by not thinking deeply enough about their condition, or making a mistake. And so there were times when I just sort of felt that I was not able to perform those duties. And I was just really honest about it. Like, look, first of all, I'm on, like, certain controlled substances that I should not be practicing medicine on. And that was at one point.
Right.
But even when I was off that stuff and my brain was recovering, I just had to be really vocal about it. And so I want
Mm.
to empower patients, because um, that is a tough spot. There's not, like, any lab test or brain scan that you can
Mm.
get that says you're this much better from your chemo brain. And so
Mhm.
that's a really hard time period, because you might even start looking better, or you're putting yourself together and people are like, you look awesome. Are you back to work? And you're just like, oh my God, like, the car looks okay. Don't look under the hood. And I think that's an important place to be vocal about that, because nobody can tell by looking at you. There are some, like, chemo brain or chemo related cognitive impairment neurological assessment tools that can be used, like
Hmm.
questionnaires, but I don't think a lot of places use those, actually.
Mm.
And so I think they just sort of rely on patients to say, I don't feel better enough to do my work yet. And it really depends on the type of work that you have. You might be somebody who has a really physical job that's not super cognitively intensive, but maybe you're a marriage and family therapist and you need to be able to, like, pay attention and think and remember things to
Right.
to provide counseling. So it really depends on, like, the type of work that you're doing, and how much better you feel. So just be your own self advocate, because at this point there isn't a standard for assessing how impaired somebody continues to feel and whether or not they're able to perform the duties of their job. That could be a really tricky time period in survivorship, in recovery, in ongoing treatment.
Wow.
So yeah.
How do you tune into yourself enough to figure out what's right for you? Like how capable you feel day to day, whether, yeah, you're ready to go back to work or not. How do you tune into those things in yourself to really feel comfortable going forward or not?
Yeah. Well, sorry, before I answer that, I just want to mention
Yeah.
one thing, because we on when it comes to the coming off of the supportive medications and everything, I just really want to let people know that if you're having an experience, an emotional experience, a neurological experience coming off of those medications, that does not mean that you're addicted. You have brain receptor habituation, which is different than addiction. So that means that, like, if we give anybody, an animal or human being, this many milligrams of opioid or benzodiazepine, which is like Ativan, Xanax, something like that. If you take this much of this medication for a certain amount of time, your brain receptors change and become regulated. They get used to the medication, so that when it goes out of your brain, you may experience negative effects. that does not mean that you're an addict. So addiction is a little bit like, you might experience physical symptoms, emotional symptoms, withdrawal symptoms, but addiction is more like, are you using the medication improperly? Are you lying about trying to use the medication? Are you diverting it? Are you saving it all up and then taking it in larger quantities so that you can experience a high? And that's a very different thing from somebody who's taking the medicine exactly as prescribed and then just having a really hard time getting off of it. And there are not like streamlined systems to help people walk through that experience. And so I know that I felt really shameful and super embarrassed about the fact that I was having such a hard time. I was, I knew that there were medications to help relieve some of those symptoms of coming off those other medicines. But I was afraid to even have that conversation. I was afraid to ask for them because I didn't want to be labeled addiction or have that addiction question come up, because I wasn't addicted. I took it exactly as prescribed, but I felt horrible coming off of it. It caused, really difficult time period for me. So I think having that conversation with your primary, with your oncologist, and just letting them know is really important.
Yeah.
And okay, so you were asking about how do you sort of get in touch with that?
Yeah, that inner voice that you may have that knows yourself, knows your brain, what you're capable of.
Yeah. Well, I think part of it is thinking about what it is that you want to do or what you need to do, and then really being honest with yourself about whether or not you'll be able to do it, to perform, but then also not comparing yourself to exactly who you were before. Like, I don't think I'll ever be the same as I was before my cancer. And in most ways, I think that's pretty good because I like myself better now. And, but there's certain things still, like the multitasking thing is something I struggle with. Like if there's, dogs and kids and lots of things going on, my brain has a hard time filtering out the noise and focusing. So I use a lot more scribble sheets and, calendars and reminders on my phone, and Post-its on my mirror in my bathroom, to sort of keep my head straight, especially if it's something important that's coming up. And that's different. I didn't need to used to do those things. And so I really talked to myself like, okay, this is not a failure. It's not like a lesser thing. You are just a different brain now. You're a different human being, and you require different tools to perform in a similar capacity than you used to. That doesn't mean that I have failed, and it doesn't mean that you have failed. If you still want to do what it is that you love to do, but you may need accommodations, like you need more time to solve a problem at work, or you need to be able to take breaks, or if you did work before, but it's better for you to work just during the day and get regular sleep every night so that your brain can process properly. Maybe that's a conversation. So think like ways to sort of adjust your work going forward so that you can do some work in a different way that continues to like fill your bucket and make you happy, without the judgment that it needs to be exactly what it was before, because it might not be that way. And I think a lot of people ask me questions like, am I ever going to feel normal again? And I remember thinking like, am I ever going to feel normal again? And the answer is yes, but it might just be a totally new normal. Like normal, meaning that you feel good in your body, good in your life. You have functionality. You're able to connect with others in your family and your community in a way that's meaningful for you and gives you like joy, meaning, and purpose in your life. but it might be really different than how you were before you had cancer. And it's okay to grieve that. And then once you move out of the grief, like, don't be afraid of it. Let it evolve into whatever it is, because it might be even better and more meaningful than what you had before.
Wow, that's incredible. Well, I think that's a good place to wrap things up. I mean, thank you so much for sharing all of this with us. Your insight and your experience, I mean, is incredibly valuable, and I know it'll resonate with a lot of people. Is there anything else you want to add before we end this and move on?
I just, like, all of you mean a lot to me. And I just love this cancer community that, like, you guys are my peeps. I just feel so loved and so connected with all of you. And I know we're all walking our own walk, and that looks very different from person to person. But I just, this disease has taken many things away, but it's also given me so much. Like, I have made friends that, like, I'd never imagined. I've connected with people and communities that it's just beyond my wildest hopes and dreams of where I'd be at this point in my life. And it happened because I got cancer, which is sort of a weird and crazy thing to think about, but it's the truth. So
Wow.
just thank you to all of you for all your support and your inspiration and your real talk. And it keeps it, you know, it's been so meaningful for me to give a voice to the survivor experience, but I know that I'm just a single voice. I'm just one voice, and there's so many voices out there. And so I know that I don't speak for all of us. There's people that have way different experience than mine. But I just feel honored to give, to give a voice, to give my voice to the experience, to help maybe the medical community provide even better, more comprehensive, more loving, more compassionate care for all of us that are, trying to live our best lives, regardless of where we're at in cancer. So, yeah.
Right. Oh, it's huge.
Yeah.
Thank you so much for sharing. I mean, I feel like we could talk all day, all night, and
Totally.
there would still be more to cover. This is
For sure.
incredible.
Next time I'm going to get my camera angle right over
yeah,
here.
we'll figure it out. This is the first one. We'll definitely do these again. And for anyone watching that maybe missed part of it, we are going to be able to have this available to watch later. We're going to have the recorded version up. If you want to just send us your email through, if you click our link in bio on Instagram, you can sign up for our email and we will email you this entire conversation. So well, let's do this again, Dr. Sam. This was so great. And I'm sure it'll touch so many people. And thank you. Thank you from the patient story, because you are incredible.
Thank you guys. So awesome to be part of it. Rock on.
Yay.
Okay. Have a good day.
I'm going to turn off the recording.
Bye, everybody.
Bye.
Bye.